This is the quadratus lumborum, known as the QL for short, and paraspinal release. For the QL and paraspinal release, there's two areas you're going to want to hit. We have, this is my spine right down the middle here. Okay, right down the middle here. You're going to want to hit directly next to it. That is the paraspinal muscle. It runs up and down along the spine. And then you have the QL muscle, which is directly next to that. That attaches from the ribs to the pelvis, and that is just a little bit more lateral. You're going to need your lacrosse ball to do this. Find a wall that you can put your feet on. You're going to lay on your back. You're going to be somewhat in a type of squatting position. I like my knees and my hips to be less than 90 degrees here. This is so when you lift your butt up off of the ground, you're not pushing yourself away from the wall, which can make the release uncomfortable. So you're going to take your lacrosse ball or tennis ball, and I'm putting it in that first spot I showed you, directly between the rib cage and the pelvis, just next to the spine. You can do the left and the right side. Here I am doing the right side. Once that ball is in the proper place, you do not want to be on the spine. My back is now arched over the ball. You're going to gently push on the wall to lift your butt up off of the ground, and it's going to feel like you're balancing your low back on the ball. It'll take about 15 to 30 seconds to start to feel this release, and it turns into a bit of a dull ache. And you're just going to breathe into that. If you feel anything other than a dull ache, which can be burning kind of in the back there, or a weird sensation into the quad, move the ball. That means that we're kind of jamming the joint a little bit, and it's creating referral pain. Once you've laid here for a little bit, for a few minutes, it feels pretty good, you're going to gently rotate to the side that the ball is on. So this is on my right. I'm going to rotate my knees and my hips to the right a little bit. That rolls the ball laterally to that quadratus lumborum, also known as the QL. And this muscle feels a little bit sharper. The pain is a little bit sharper when it's being released. Again, you're between the pelvis and the rib cage. It's kind of that softer spot in there. And you're just going to relax into this. You're going to do this area for about 7 minutes. Once you find a spot, don't move. But when that spot starts to feel better, you can find a new spot.